All right. Thanks to those of you who started to introduce yourself in the chat. And we are streaming live now. So I'm going to go ahead and get started with the introductions. My name is Geneva Blackmer. I'm the Interim Executive Director for the Interfaith Center at Miami University. We are a 501c3 nonprofit organization that seeks to unify people through relationship building, dialogue, and social action. And this workshop is made possible by a generous grant from the McCullough Hyde Foundation and the Interfaith Center's Building Healthy Communities, Strategies, and Resources for Faith Communities project. And today we are joined by two wonderful speakers. And I actually forgot to ask you both who would like to go first. Do you have a preference, Perry and Audrey? No? Okay. Well, I have Perry's bio up first, so I'm going to start with you. Perry Hall has been a lifelong kidney patient and started volunteering for the local foundation in 2007. She's in her 13th year as an employee with the National Kidney Foundation and enjoys connecting with people on their own kidney journeys. So that, I'll turn over to you, Perry.
Hello, everyone. This is actually incredible seeing where everyone is tuning in from. My name is Perry Hall, and I am the Senior Development Director with the National Kidney Foundation here in Cincinnati, Ohio. And I have been in this role, I want to say 7 years now, but I started with the local foundation, as Geneva said, in 2007 as a volunteer. And that was just shortly after I received my first kidney transplant, or that's shortly after I started dialysis. I actually got hired on after my kidney transplant. But my story, do you want me to go into my whole thing, or do you want to introduce Audrey first? You let me know, Geneva.
I think that you can share your presentation and then I'll introduce Audrey.
Oh, perfect. So I started my kidney journey when I was 17 months old, and my parents noticed that I hadn't been using the restroom. So I was taken to the pediatrician. They prescribed a Sulfa drug for a kidney infection. I received too much of it and was then taken to Children's Hospital for an overdose and blockage in my ureter. And they found out I was born with just one kidney. So I lived at Cincinnati Children's for 3 months while they did 5 major surgeries. My native kidney came back to 85% function. And I was told, or my parents were told, that basically I should live in a bubble. I shouldn't carry children, not play sports. And thankfully, I was raised by parents who let me have a pretty normal life. The doctors also stated that I would probably need a kidney transplant by the time that I was 13. Luckily, that did not happen. I played sports all through high school, went to college, got married, had 3 children, and then unfortunately, my native kidney failed, and I had to start dialysis shortly after my 30th birthday. So no complaints. My native kidney doubled its life expectancy and gave me my first 3 children. And then I was on dialysis for about 4.5 years, splitting my time between being in center and doing chemo at home. And then after that 4.5 years on dialysis, I received a deceased kidney donor. And that kidney lasted 9 years. I was able to have another full-term pregnancy with that donated kidney. And after it failed in 2020, just shortly after COVID started, I went back on dialysis for another 2.5 years and received my second kidney transplant in May of 2023. So that is my kidney journey side of things. And then my NKF side of things, when I first started full-time, I was a walk coordinator, and I only oversaw our kidney walk, which is coming up. So make note, that's in May 18th. And then I've been here long enough to have worked my way into a lot of different avenues and have overseen pretty much all of our programs and our fundraising events, which now include walk, golf, and a gala, which is Dining with the Stars. So pretty much I live my mission and NKF's mission. And if I have anything to offer, I am happy to do so. I love meeting new people anywhere they're at on their kidney journey. So I hope to be a resource. As far as the National Kidney Foundation goes across the country, we do advocacy in Capitol Hill. We also have peer support groups that meet via a hotline or through email. And then, excuse me, we have a lot of resources on our kidney.org website. And then here locally, we offer a in-person peer support group. We have a lot of different resources as far as becoming a living donor, as well as the process that you'll have to work through to receive a kidney or be put on the list. And that program is called The Big Ask, The Big Give, as well as other local programs we run, Your Kidneys and You, Your Kidneys and Youth. Those are both programs that we come out into the community and talk about what your kidneys do and how to prolong the life of your kidney. And then the youth one is run through partnerships with our local school districts. So I think that's pretty much a very broad overview of everything NKF does. And like I stated, I'm happy to answer any questions and share more as we work through tonight's seminar.
Thank you so much, Perry.
Absolutely.
So our second speaker will be Audrey Holtzman. She is a fearless leader, passionate advocate, and dedicated change maker committed to empowering underrepresented and underinvested minority communities. With a commanding presence and an extensive external network, Audrey excels at building collaborations, setting clear goals, and creating impactful events and initiatives that drive real change. Inspired by a deeply personal experience, the tragic loss of her brother to a drunk driver in 2011, Audrey found purpose in the field of organ, eye, and tissue donation and transplantation. Witnessing the power of organ donation firsthand, she has since dedicated her career to honoring that legacy, advocating for education, access, and equity in healthcare and donation services. Mission-driven and community-focused, Audrey leads with a big heart, unwavering passion, and a results-oriented mindset. Whether mentoring, organizing events, or shaping policies, she remains steadfast in making a meaningful, lasting impact. And with that, I will turn it over to you, Audrey.
Hello, everyone. Good evening. Thank you for taking time out of your evening to join us to hear about kidney health and also about organ and tissue donation and transplantation. As Geneva said, I am Audrey Holtzman, and I am the Diversity and Inclusion Program Manager for Network for Hope. So Network for Hope is the local organ procurement organization, which we refer to as the OPO. We service 7 million people in 136 counties across the states, 4 states, which is Indiana, Kentucky, Ohio, and West Virginia. We are the 16th largest OPO out of 55, and we work with 188 hospitals, 6 of which also serves as transplant center. So in my role as the Diversity and Inclusion Program Manager, it is really to drive the organization's DEI&B strategies, fostering a more inclusive and equitable work environment while also enhancing cultural competence to better serve the donor community and their families. Internally, we achieve this through biannual DEI&B trainings, quarterly lunch and learns, and ongoing initiatives that promote meaningful cultural change. externally, we focus on building strong partnerships with faith-based organizations, communities of color, and multicultural groups to create lasting impact and trust. And so tonight, really wanted to focus on or talk about health disparities that affect transplant outcomes, some of the historical mistrusts within healthcare, and also donation and transplantation, and then underrepresentation in donor registration amongst our minority communities, and also cultural and religious considerations. And so Perry and I will kind of uh, tag team on kidney health, what that means on the NKF side, and then also what that means within our minority community and in the healthcare system as a whole. So feel free to ask questions. We're here for them all. And so we'll go ahead and get started. So Perry, I'll let you continue, and then I'll pick up on my side of it.
Yeah, I think as far as the National Kidney Foundation is concerned, we try to promote kidney equity, especially when it comes to transplantation and being listed on the transplant list. We see, as Audrey mentioned, sometimes there's a mistrust with the doctors, or there are people who are already eliminating themselves before they actually take the initiative to either be put on the list or to see if they could even become a living donor for a loved one. So one of those things that we do is try to, take down that barrier, try to open up communication between the patient and doctor, and really push for the patient to be a self-advocate or to seek someone out who could help them speak on their behalf with the doctor. As far as people that are dealing with kidney failure, we find that it's not necessarily broken down by race or those types of backgrounds. It really falls into things like where the person is living. Are they living in a food desert? Are they a rural patient? So it's harder for them to get transportation to and from their appointments so that they're compliant with the things that they need to be doing. So hearing from the patients and trying to work with them on that end to find resources so that they can be listed, or that they can take better care of themselves prior to being listed, I think is another major thing that we try to do. Audrey, did you have anything you wanted to add on that end?
Yeah, so speaking of that some of the health disparities that minority communities face, or communities of color face, when it comes to transplant. So when we look at the country as a whole, there's about 104,000 people that are on the transplant wait list that are waiting for organ transplant. Out of those 104,000 people, there are 90,000 who are waiting just for kidneys. And so looking at the numbers, 39% of those 90,000 are Black that are waiting for kidneys. Then one of the main reason for that is Black and Hispanic individuals are disproportionately affected by conditions like diabetes and hypertension, which increase the need for organ transplant. And so despite the high need, these groups face longer wait times for transplants due to a lack of diverse donors, making culturally competent outreach, like what I do, very essential as well to get those groups registered. So compare with whites, Blacks have lower rates of even signing donor card, right? So 39% versus Blacks versus 64% versus white. that sign the donor registration card that says, yes, I, want to be an organ and tissue donor after I die. And so there's a huge disparity when it comes to that. And I mentioned the lack or the historical mistrust that comes with that too in healthcare. So, and rightfully so, because of, medical mistreatment. For example, like the Tuskegee study that was done years ago on Blacks, that has led to a lot of skepticism about donation and transplantation. And then many, people from underrepresented communities fear that organs will be taken prematurely, or that they won't receive the best care if they are registered as donors. And so those historical mistrusts and what we call misconceptions really keep underrepresented communities, Black communities, Hispanic communities from wanting to even designate themselves as a registered donor. So that's kind of the battle that we're facing too. And so we're really working hard in these communities to educate, take away some of these misconceptions, form meaningful partnerships to build trust within these communities so that it'll drive people to register, especially those who are so desperately needing to have a transplant. So we need more people on the backside of that to register. So when the time comes, the match will be optimal for that too. So, that's a lot of the work that I do on my end.
Yeah, I would agree wholeheartedly with Audrey and the numbers that she is sharing with the National Kidney Foundation as far as the diabetes and high pressure go as being the leading causes to kidney failure. The thing that the NKF is trying to do is swim further upstream to try to kind of divert those issues ahead of time. Nutrition plays a very large part in both of those issues that are causing most of the kidney failure. But that doesn't exclude the people who are already on that track because of whatever disease they might have. Myself, I was born with one kidney. My coworker, she would be happy that I was sharing that she actually is a lupus nephritis patient. So there are things outside of our control that we obviously have no say over, but then there's also things that steps we can be taking to better our health prior to letting things get too far. Not to say that the inevitable won't happen, that we won't reach the kidney disease phase of it, but if we can prolong the kidney health, I think that's a big, important headway that NKF is trying to make as well.
So a lot of the communities that I've been working in, as we've also been trying to tackle the front end of that to avoid people going into kidney failure as well, with different initiatives. And so last year we started a couple initiatives. One we did with barbershops and beauty salons. So we went into our local barbershops and beauty salons and talked about kidney health. We also had kidney recipients that were with us that shared their story, their journey on how and what led them to needing a kidney transplant and how people can eat better. Because we all know your barber, your beautician, they know everything about you and everybody else in the shop. And so just forming those relationships and then giving them the information to share with their clients, because we can't always be there, was so impactful. And so that's an initiative that we're continuing to do, because again, just educating the community on the importance of your diet and how that can affect your kidneys. But then eventually there are some things like Perry said, sometimes there's things that you just can't do, and it will lead to you needing a kidney transplant, but also giving people the information that they need um, to be able to register on the transplant waiting list, like what are the transplant centers that they can go to, who can be their advocates in receiving a kidney, because you can't, I mean, it's not always where you're waiting for a deceased patient to get a kidney. You can also advocate for yourself to have someone, a living donor, that'll donate a kidney while they're still alive as well. And so just showing the community those different avenues of how they can be advocates for themselves, and then building back that trust too within the healthcare system, to drive people to yes, there are some disparities in the healthcare system, but it shouldn't stop you from being your own advocate. And if you're equipped with the knowledge and the education that you need, you can be confident enough to navigate the healthcare system. And so that's a lot of the education that we've been doing in these communities as well.
I think it goes back to the trust portion. Like, you're going to trust the information that you receive from your friend or a family member more than just an outside source. So when you're going into the local barbershops, or us even having this call with hopefully the information trickling down to the people that you know personally, this information will create a ripple effect that is larger than just Audrey and I speaking, or even Mohammed speaking as a recipient. I think that is like the key to everything, is the trusted source. You're getting information from a trusted source. And so that's why Audrey and I do what we do, I think.
Absolutely. So the other thing that I wanted to talk about too is like cultural and religious considerations for donation. A lot of what I hear in my line of work too, being out in the community, is there's some hesitation, especially around like cultural beliefs or faith-based beliefs, and so we tailor our message to around those things, right? I hear a lot where people will say, my religion does not allow me to be an organ donor. And so I've worked tirelessly with different faith leaders to really kind of unpack, right? And so I do a lot of work with the Islamic Center of Greater Cincinnati and the imam there. And he has done several panel discussions at the Islamic Center along with myself and a few of my other colleagues, just talking about what does the Quran say about organ and tissue donation. And then we explain the process of organ and tissue donation. And it really helps people understand, while there are some religious stipulations, and I'm going to stick with the Muslim faith and use that too, where, the body has to be washed and prepped for burial within a certain time frame. And so knowing that, we make sure that donation happens in a timely manner so that the body can be washed, and that person can still be an organ donor as well. So we come at it from a two-prong approach to really help people understand, while there are stipulations within the religion, it does not specifically say that organ donation is not allowed. And so we really need people to understand those things, because you all know we take one thing and we run with it, and the next thing you know, it is grown legs and arms and everything else. So
Yeah, I think when I'm out in the community, the largest benefit is that I get to share that I'm a two-time recipient, and people look at me and they see that um, it totally changed my life. You know, you can't tell that I've received two kidneys, and I think that encourages people to ask questions and see that they can really save a life upon losing their own. And so I try to use that as a benefit or a baseline when speaking to people, um, to encourage them just to see that it really does save lives. It's not just something that we're talking about, um, and that it happens to someone else. You know, it personally happens to me, and I'm standing here in front of you today as a two-time kidney recipient.
I could add on real quick if that's okay. I don't think I've introduced myself, but my name is Mohammed Alamdi, and I'm Fatma's son. And I'm also a kidney recipient of 6 years. And to kind of add on to Audrey's point, because we're pretty big members of the Islamic community here in Cincinnati, and especially with the Islamic Center of Greater Cincinnati. And I remember when I was going through my stuff, you hear whisperings and stuff of like, oh, is this allowed? Or like, oh, what's going on? Like, a lot of people knew I was sick, but it almost got to the point I'm like, wait, is this even allowed? Is it okay that I'm getting a kidney transplant? But the imam at the center, he has been, like Audrey said, pretty incredible and a very big proponent of organ donation. And I think I actually spoke at the first one that they held with one of, I guess it's the Network of Hope for Hope, probably. But just to kind of, I think it's big for me because for me, organ donation is obviously, it's changed my life. Um, in just incredible ways. Like I honestly, I shouldn't be here today, but it saved my life, and I'm able to now. I feel I have not only the duty, but like responsibility and opportunity. Like I feel so blessed just to be breathing every day and get to enjoy like every little moment. So I want to, share my story, especially with my community, but also people just, across the world, just because like Perry said, like we're kind of testimonies to just how important this is, and I think it's important, like to kind of dispel any myth and just continue to share that story. But,
And Mo, if you wanted to share your story, I was going to invite you to do that. So I don't know if you want to do it now or wait till
I
a bit
could, yeah,
later.
I didn't want to take away any steam from anybody, but yeah. So what happened was I was a sophomore at the University of Cincinnati, kind of, living life and enjoying life as much as, any sophomore would. And then I went to get my wisdom teeth taken out during winter break. So what happened was I went to get my wisdom teeth. They had the IV in my arm. Everything was looking fine. And then they stopped the procedure. The orthodontist came in with the widest eyes I've ever seen. And what ended up happening was my blood pressure was 200 something over 100 something, like very dangerous. Yet here I am with no symptoms or warning signs or anything. So my dad was with me and we were kind of like, are you joking? Like it's almost like we couldn't believe it. But they refused to do the procedure. And the next day I went to get my blood work done. And um, later that night, we received a phone call at my home and they told my dad, take your son to the emergency room. He could die any minute. And so we went to the Westchester branch of the UC hospital. We stayed there till 3 a.m. And then at that point, they're like, sorry guys, but we don't even have the capabilities to treat you here. So we're going to have to transfer you down to Clifton. So at that point, it's kind of like we knew it was getting pretty serious. So I spent 2 weeks in the hospital. I had some emergency surgeries. I got a dialysis catheter in my chest. And, my whole life changed in, you know, just the blink of an eye. And so I did dialysis for a year. I tried to continue the best of my abilities with my school. Thankfully, I was able to, you know, I have an amazing support system, as I'm sure some of you know, my mother and my father and my siblings and people like Perry at the NKF who all inspired me and kind of motivated me while I was on this path. And so I continued with school. And what ended up happening was my roommate in freshman year, and my best friend, my freshman year roommate, he ended up giving me his kidney. And I guess to kind of tie into interfaith, this kid, Julian, he comes from a Jewish background and I'm Muslim. And for us, it was never even like, that has never even been brought up as like an even a question in terms of our friendship or anything like with what we were doing. Um, and I think a large part of that is we were raised, I think, by incredible parents. Like if any of you know my mom, it's not something like I even see in him. We're cognizant, especially now. I think we all know what's going on in the world, but he's just an incredible human. And for us, like he always says, like he just saw me sick and struggling, and he would do it because you know that's something I would do for him. And yet for me, a lot of people come to me and like, Muhammad, you're so strong, like to have gotten through all this, and like, how do you do it? But I think I did nothing other than, I just went about my day to day because I had to. He made this incredible choice and decided to take it upon himself to save my life. And it was all him. And I try and give him all the credit because he's truly just an incredible, incredible person. And, because of him, I'm here today and I'm honored to be able to share my story and actually pursue my dreams. So this inspired me to go to medical school. So I'm now at Ohio State. Hopefully I'll be able to become a nephrologist one day and kind of continue giving back. Well, that's a hope. We'll see. But yeah.
Yay!
That is awesome, awesome, awesome. Thank you for sharing.
Yeah.
So,
I think, oh,
no, go ahead,
sorry.
Perry. Go ahead, go
Oh,
ahead.
no, I was just gonna give Mo props. He actually was still in college shortly after his transplant and started volunteering for NKF. And you don't see that very often. I have a couple of people who have been affected through either their mom having kidney disease or themselves. But you don't see very many people in their very early 20s coming to volunteer and support and work our local events. And Mo was one of those people. And so I just have loved and enjoyed spending time with him and just boosting him up and cheering him on through his journey. He's going to do incredible things. So thank you, Mo.
Of course, and back at Perry, like I can't thank Perry enough. For me, like, when you go through something like this, it can feel so isolating and so lonely, especially like with someone kind of as young as me. It's kind of rare to see someone going through something like that at my age. But yet Perry was like incredible. I think I like cold emailed someone from the NKF because I just wanted to like get involved and kind of like see more of what the community was like. And I think they immediately suggested I reach out to Perry, and since then she's been just an incredible like role model, inspiration, and just motivation for how she tackles life through the ups and downs. And she has just been an incredible person, so I definitely want to give Perry her props for sure. But, yeah.
I do remember you, Mo, speaking at the first panel discussion that we did at the Islamic Center and sharing your story. So yes, we actually just did one about 2 months ago there. So but another thing that I wanted to touch on too is the end of life planning for donation, for organ and tissue donation. So a lot of people don't think about that, and just like a lot of people don't think about writing a will, because none of us think we're going to die. And that is such a thing. But one thing that I really stress when I'm out in the community with people is to make sure that your loved ones, your family members know your decision when it comes to organ and tissue donation. Because if no one knows, and if you've not designated yourself, that decision falls on the next of kin. So whoever is responsible for responsible for you at, you know, when you die, that person will then be the one to make the decision if the chance arise that your loved one can be an organ donor. That person will have to make the decision in on their behalf. And so, as you can imagine, death is always it's a stressful situation, is a situation that none of us really want to be in. And so it's very hard to, when everything is coming at you, all the planning and all those things are coming at you, it's very hard to make a decision like that when you're grieving. Sometimes there's trauma that comes along with that. And so I tell people all the time, please make sure that you're having those conversations with your loved ones, letting them know what your wishes are as far as organ and tissue donation goes. Just like you want to make sure when after you die, you want to know where all your all the wealth that you have acquired, you want to make sure that it goes somewhere, right? And so the same thing goes for organ and tissue donation. Again, if you don't make that designation, somebody else will be doing it somebody in your family will be doing it on your behalf. And so it's important to have those discussions, have those conversations, so you know where each of you within your family unit stands as far as organ and tissue goes. And so when the time comes, it's easier to make that decision. So.
And Audrey, thank you for being a family member of a donor. From a recipient, yes. It really changes lives. I know you yes. know that, yes. But I think that we should definitely express our gratitude for that. Both my donors were deceased, and I believe, I'm not sure about the most recent one 100%, but I believe both of those fell onto family to make that decision. My first donor was rather young, extremely young, which also sparked emotions as a recipient who lived part of her life at Children's Hospital that I had to work through. And but I do believe that both those decisions fell onto the family. So I am so beyond grateful and thankful every single day for not only my donor, but their families who had to make that tough decision while they were grieving for their own loved one. And actually, I was meeting one of my friends for lunch, probably, I don't know, when I was finally allowed out of the house after my first transplant, because you have to stay away from germs for so long. And I was still going on about it. Like, I was still devastated about receiving a kidney from someone who was so young. And finally, my friend looked me straight in my face and said, "Okay, you need to be quiet now." And I thought, well, that was very rude. Like, why would you say that to me? And she said, "They did not give the kidney to you. They gave the kidney to your children, the Girl Scouts that you run, the softball team that you coach. They gave that kidney to all those other kids, not you." And I was like, you're right. That's the ripple effect that me receiving the kidney had. It wasn't given to me. It was given to everyone else that I had been working with along the way. So thank you, Audrey, for being that family.
Yeah. Fortunately for me, my brother was a registered donor. And so he made his decision known, and we knew where he stood. But I do talk to other like donor families. And one thing that a donor mom said to me about her son, given the gift of life through donation, she said he didn't die to become an organ donor. He died and then he became an organ donor, right? And that really stuck with me, because and because I always tell people too, my death happens, right? My brother, there was nothing we could have done to prevent my brother from dying, but in his death, he was able to save the lives of others, right? And so, it really gives my family, um, um, uh, some peace, knowing that in my brother's death, he was able to save the lives. My brother was able to donate all 8 of his organs, and so he was able to save the lives of 6 people through organ donation, and enhance the lives of countless others through tissue donation as well. So, and I've actually met only one of the recipients just recently. Last summer, I met his one of the kidney recipients
Oh,
last summer, and it was like the most surreal thing I've ever experienced in my life. It kind of just brought everything full circle for me. And so again, I love this work that I do. Um, it just every day it gives me hope to know that there are selfless people out there that have said yes to organ and tissue donation to help other people receive the gift of life. And so,
Audrey, do you have a
yes,
percentage of people, because you have to die in a certain scenario, basically,
correct.
where you're kept alive from life support. Do you have a percentage of how many deaths actually occur in that way?
Mhm. Yeah. So the percentage of organ donors who or people who die in a way that they can donate their organs is I mean, it's 1%. So it's 1 out of every 100 people who die are able to donate or die in a way that they can donate their organs. So that number is very low. And so one of the reasons why we do call our donors heroes, right? Because not everybody, even if when people register to become organ and tissue donors, it doesn't necessarily mean that when you die, you are automatically going to be an organ donor. It just doesn't happen.
Right.
Because again, you have to die in a way suitable that your organs can be recovered to then be transplanted. More people are tissue donors than organ donors. So almost, there are very few things that rule people out from being a tissue donor. But again, there's that small percentage of people that when they die go on to become organ donors. So
Why there's
it
such a
is,
big call for
yes,
living
yes.
donors, especially because there's so many people on the wait list, because we don't pass away. Initially, we don't pass away from being put on dialysis. That keeps us alive wait while we wait, where some of the other organs, if you don't get it in a timely manner, the end result is you're passing away if a donor doesn't come in time. But dialysis allows us to live longer and wait for that kidney. So that's why there's so many people on the kidney transplant list. And we really try, I know Audrey's organization as well really pushes for finding a living donor or a living match as well. And not just waiting on that 1% who passes away in the way that they can donate.
Mhm.
Audrey, I think there's a question for
Yeah,
you.
I see there's a question in this. So if someone is sick and they're moved to hospice, so how does organ donation happen in a hospice setting? So depending on why they're in hospice, so cancer, if they're in hospice because of cancer automatically rules anybody out from being organ or tissue donor. Okay, so if they're in hospice because of cancer, they cannot become an organ or tissue donor. Um, some some hospice patient can't be they can go on to be cornea donors. So corneas is the thin layer in the front of your eye. Okay, we do work with hospice centers for that reason. Um, and so it depends on why the person is in hospice, right? So if it's hospice care because of cancer, again, that person cannot be organ or tissue donor. Okay. Um, and then there's a question about someone who's been waiting for 2 years, waiting for a kidney. So what I would say to you is, they're in Columbus. I would register. So if me, Audrey, was waiting for a kidney right now, I would register at every kidney transplant hospital there is in my radius. There are lots in Ohio.
And there's a lot of testing, but you can do it. Yes, you can
Yes.
be listed at many, multiple
multiple transplant centers. A lot of people don't know that. But it does raise your chances too of receiving the gift. Okay. And then there are some things too that the transplant centers look at before you're even transplanted. So you have to kind of be really sick, but not sick enough that you can't withstand the surgery, right? So there's a balance there too when people are waiting. And then it depends on where you are on the wait list, waiting. And this is for a deceased donor. Okay. If you advocate for yourself and you then get a living donor, you actually don't have to be on the donor registration list or transplant registration list to receive a kidney from a living donor. Okay, so you bypass that list if you have a person that says, a friend, relative that says, "Hey, I would like to give you one of my kidneys." So that's the other way to do that as well.
I think there are a few more questions in the chat, actually. See one from Kathy. What do you see as the biggest
biggest barriers to donation?
To donation from faith communities?
Again, like I said earlier, a lot of it is, it's somewhere in, our religious beliefs there, we've heard something that says, and let me, since I used the Muslim faith earlier, I'm going to use the Christian faith now. People that have said, I've heard, folks say, I'm not going to be a donor. I'm supposed to take everything with me when I die, right?
Oh, I'm supposed to go home. Yes.
and so that, is one of the things that I hear people, Christians will say, I'm supposed to take everything with me when I die. And so, the way that I combat that is, I then go to the Bible and says, well, the scripture says that God will make everything new, right? And so that totally contradicts the fact that of people saying, I'm supposed to take everything with me. And so that gets people thinking too. They're like, oh yeah, you're right. But somewhere, in a conversation, maybe with family members or whatever, they heard that they're supposed to take everything with them. And that's just not true, right? And so that's some of the stipulations that keeps people from their religious beliefs from becoming organ donors. Again, I've done a lot of work with a lot of faith leaders that have spoken on organ donation and are, every major religion supports organ donation as a final act of kindness. And so for that reason, every major religion supports donation. So there's a thing that Aisha put in here about, I think somebody mentioned the ventilator, the patient being on a ventilator. Yes, and it is true. The person is not kept on a ventilator for just for donation. The donation doesn't happen until the patient has actually been pronounced dead. And so once the person is pronounced dead, then the conversation of donation starts. Okay, we're not allowed to even talk about donation. Actually, hospitals are not even allowed. Doctors, nurses are not allowed to approach a family about donation. That conversation comes from OPOs like Network for Hope. So once the patient has been pronounced dead, then someone from an OPO, the local OPO. So if it happens here in Cincinnati locally, it'll be one of my staff members that will do the approach on the family, meaning if we're checking in the registry to see if the person is registered, their donor registration status. So if they're a registered donor, we're letting the family know that their loved one is a registered donor, what that process of donation looks like. We're supporting the family through the whole donation process. And then if there's not a designation, then if that person, again, dies in a way that's suitable for donation, then we're having a discussion with the families, like I said earlier, if they would like to have their loved one be an organ and tissue donor.
That's after like multiple tests. It's not like your loved one fails one brain dead test.
Right.
There's like a series of tests that they have to do to make that confirmation.
Yes, that is correct. So I think I'm okay, yeah.
There was a question for Perry, but I think she already answered it in the chat.
Yeah.
Are there any
Okay.
final questions or comments?
It might be easier for me to ask the question without typing it, if that's okay.
Sure.
Because of those barriers of distrust amongst minority communities that you talked about, and I've been involved in both the donation side and the transplant side as a chaplain. I get that. So is it easier for someone in the minority community to be able to have a living donation, like for kidneys? Because then that's not the issue of, oh, they're keeping my loved one alive. Or, I mean, they're, like distrusting the process of how a person is declared, pronounced, dead, etc. And some of those myths that go around how we care for people. So is there, I guess maybe I can make that more succinct. Is there a higher percentage of living donors amongst minority communities?
I would
No.
say your first, no, I would say the first step for that person, if you're talking about the potential recipient, is just to make sure that they are registered with a transplant center, if not multiple, like Audrey said. Once they go through their testing and they're registered, they're automatically put into UNOS for receiving a kidney transplant from a deceased donor. And then they can start advocating and looking for a living donor. I would also encourage them to talk to their transplant center about being listed in the paired exchange program. And that is, if somebody does step forward on their behalf who is willing to be a living donor, but they don't match, then they will be entered into, and that person is well enough to donate on their behalf, they will be entered into this database, and they can find kind of a paired match and then do a switcheroo or a chain donation. But I would definitely say the first thing to do is get them on the list, have their workup completed, and then multiple things can happen at the same time with them being listed for a deceased donor while they're looking for a living donor.
So and I said no, but let me explain why I said no. It's much harder for someone in the minority community to find a living donor versus their white counterparts, right? And the reason for that too is because when you're looking for a living donor, you're typically looking within your network, right? Your family members and those kinds of things. again, I stated at the beginning how Blacks, Hispanics, just people of color in general have a higher propensity to have diabetes and high blood pressure. And if you have any one of those things, it's going to rule you out for being a living kidney donor. So there's that piece of it. So a lot of times what we find is, even though, someone who's Black is needing a kidney transplant and they have a family member that wants to be a living donor, they can't, because after you do all the testing, then you find out you have high blood pressure, or you have diabetes, or something that rules you out as well. And so that's why the number is lower in communities of color as well. So it's not for the lack of not wanting to, but for some of those reasons. I mean, there is that underlining too, where, again, the mistrust, where, someone is like, well, what if something happens to me? Or what if something happens to my child and they need a kidney and I've given it to somebody else, then what, right? So there's all those things, those questions that people have as well, that keeps them from being a living kidney donor.
No, Audrey would
Thank you.
agree,
That's
but we
helpful.
always say, don't rule yourself out as a
Correct.
donor. Just if you're feeling compelled to be a living donor, just start the process, and then through the workup, the transplant center will tell you if you're able to donate or not, because they want the donor to be as healthy as possible. They don't want to take your kidney and then your health goes to the wayside. That's not how it works either.
Very helpful. Thank you.
Were there any final questions?
And if I just wanna comment in Kathy, just building what Audrey and Barry just said. I think it's harder for the minority to find a living donor. First of all, to find living donor, you have to start with your family. I learned it in a hard way. Like, if there's somebody who is willing to do, and he will be more compelling if somebody close, like brother, cousin, whatever, like sister, sibling, or like related person. For the minority, like in my case, like the African American, in my case, I don't have family member here who lives around me. They're all thousands of miles away from me. So the only way to find a living donor is a friend. So I took it upon myself. I was like just approaching people, knocking in doors, and educating people about how to donate. And donation does not affect your health. If you are healthy and you are good enough, you can I learned as from my son experience. Like, took us months to know and to have the courage to ask people. And it's really, and I remember somebody connected me with the living donor, and she shared her experience with me. And I know she's just so beautiful and young, and 5 years ago, later, did not affect her life. So I was like bringing her to like my friends and stuff. I say, hi, she's a living donor. Nothing happened to her. She's like, she living her life to the fullest. So this is what happened. So I was approaching people, educating people, talking to them, and by the grace of God, and we were so fortunate and blessed to have Jillian in our life, who stepped up and gave his kidney to his friend.
Yeah, that is so true. So true. Like, like you said, you have families, your family is, really millions of miles away. And so, you don't have that network of people with you. The other thing Aisha put in the chat too is we just don't talk about our health. We don't talk about those things until literally it's too late, right? Or until we're in the thick of it, and then it's like, oh, what do we do now, right? Which we should be talking about it, on the forefront, so that if, hopefully we don't ever need to, but if we already are educated about it and we know what to do and we're ready to go, right? And so that's kind of why, Perry is out talking about this, myself, we're out educating people about these things because we know these conversations don't normally happen. And so we're really encouraging people to have these discussions about their health, and health outcomes. And that's how we change it. That's how we make those changes.
All right. Are there any final questions or comments? Anyone have anything they want to add?
I would just add that it just takes one person. It just takes one person to share what you heard tonight. It just takes one person to decide they want to be a living donor and make the phone call. It just takes one person to sign that they'd like to be an organ donor on their driver's license. It just takes one person to start that ripple effect. And so I think, probably not to speak on behalf of Audrey, but to speak on myself, is that's why we do what we do, is because we're hoping to reach that one person, and then that one person reaches another person, and so on. So I think I would like you to take that away. If you leave here and share it with at least one person, then you will be helping the cause.
Absolutely. I totally agree.
Great. Well, thank you, Perry. Thank you, Audrey. This was wonderful. And thank you to Mo. I know he had to leave, but I really appreciate all of your time and sharing of your stories. And I did want to ask if you have any resources that I might be able to send out. I did get a request for that, or if anyone has a toolkit of resources, I'd like to send it out to all of the participants. So if you guys could get that to me after the program, that would be great. And also great. I will send out the resources with the recording to everyone who registered, and we'll also send out to our mailing list. So thank you all so much. And thanks again to McCall Hyde Foundation for the generous funding they provided. And I hope you all have a great rest of your morning, afternoon, or evening, wherever you are in the world.
Good seeing you, Audrey. Bye, Fatima.
Bye.
Bye, Barry. Thank you. Thank you, Audrey. Thank you.
Bye.